Good day! So, my research paper for international organization is about the World Health Organization and the COVID-19. So, my baby thesis is entitled The World Health Organization on Coronavirus Disease or COVID-19. I personally chose the COVID-19 as my topic because it still exists up to this day. We have been struggling for over a year now, and even though we have vaccines for the said disease or for the said virus, we are still on the rocks against the virus. On the other hand, I chose the World Health Organization since it is an agency made by the United Nations, especially made for the international public health. So the combination of the two is very relevant to our situation right now since we have this pandemic and we have the said international organization to help with our health. As I have said, the World Health Organization is an agency made by the United Nations who prioritizes the health of the public. They were established in 1948, and since then they have been really helpful with their through their contributions for all the medical related issues that we have or that we had throughout the years. Just like the other international organizations or agencies, the World Health Organization also had its successes and its failures. For its success, they helped to stop the outbreak for smallpox, and for their failures, they have been known for their late response on fighting against the Ebola outbreak in 2014. And even though they had their downfalls, the said organization still made a way for them to rise up again, and they still made a way for their responsibilities for the international public health. And now they are very responsive, very informative to the public regarding the said virus because the people deserve to know all the information and all the details about the said virus because it is for their safety and it is for their awareness. For the said virus, it started in 2019 in Wuhan, China, when the Chinese people in Wuhan started to alert the World Health Organization about the increasing cases of the said virus. It started to spread all around the world in the first quarter of the 2020. In the Philippines, we started to have cases in March, and the lockdown started also in March. The said virus is caused by the bodily fluids that an infected person has in his or her body, and it could be shared through coughing, through sneezes, and through their saliva. An infected person can experience mild to moderate respiratory conflicts, but they can still recover from it even though they are not being checked. In 2020, on the first months of the quarantine or the lockdown, a lot of people were very scared on the infection of the pandemics because they think that it is not curable. But in today's year, in 2021, people seem to adjust with the situation, and they just get along with it, and they just started to get very mindful, very careful about the environment because we can avoid going outside because we have necessities and we have other things to do other than staying at home. So to connect those two, the World Health Organization has been really helpful in fighting against the COVID-19, and they were very responsive for the vaccines that the world needs right now. And that's all for my baby thesis for international organization. Thank you for listening.